earlier I spoke to Dr. John Puntis, co-chair of Keep Our NHS Public and a retired consultant paediatrician. And I started by asking John for his reaction on what was revealed today.
It's deeply upsetting, the suffering of the patients and, of course, their families, because this extends very widely throughout our society, is quite staggering. And to hear that there were cover-ups and to hear how members of the medical profession were of patient concerns is, hugely depressing for someone. Well, for all of us, but, me as a clinician working in the NHS, where we all wanted to do the best we could for patients. And then to hear that these kinds of issues arise and go on for years and years and years is very depressing. And of course, the question arises, what can be done to prevent this in the future?
John, of course, this goes back to mistakes that were made in essentially buying and then giving contaminated blood to patients here in the UK. In many cases, and we heard from one of them earlier in the programme, people didn't even realise they'd been given contaminated blood for years, for decades. And yet it must have been apparent to clinicians long before that the scale of the problems that they were creating for patients here in the UK.
Well, it was certainly apparent to some clinicians, wasn't it? And there were those who did warn against it. I think the WHO had flagged up years before that there was the potential for viral transmission in blood. And I think as far back as 1974, it warned against importing blood products from the States because of the high incidence or high prevalence of hepatitis in the States. So there were a lot of warnings. And of course, the other thing I think, which comes out in pretty much all inquiries like this, is patients' concerns not being listened to. So patients actually articulating that they were ill and that they wondered if it was related to treatment they'd had, blood products or blood transfusions, and that being dismissed. So it's a very sad state of affairs, and few people come out of this well. And I think it will fuel people's distrust in the NHS, but very much also in the kind of political framework which is around the NHS. And it isn't really a party political thing, but some politicians clearly haven't come out of it at all well. Ken Clarke's remarks, particularly that there wasn't conclusive evidence, despite the fact there was a huge amount of circumstantial evidence, his irritation at questioning at the inquiry, John Major saying that it was bad luck, didn't go down well with patients and families. And we really have to think very, very carefully about how the NHS and politicians become much more focused on patient safety and listening to patients. And part of that is also encouraging openness and a whistleblowing culture in the NHS, again, which we hear about time and time again.
John, what do you think then needs to change the culture within the NHS, as well as more widely in our politics, but perhaps as someone who's worked within the NHS, what has to change to prevent something like this from ever happening again?
Well, as I said, listening to patients, you'd think that would already happen, but all these inquiries, including the recent maternity care ones, say actually the other patients aren't listened to. The other thing is listening to staff, so encouraging an atmosphere in the NHS where people can report their concerns. And at the moment, the proportion of staff that say they feel safe about raising concerns has actually gone down. Andy's right about the trustworthiness index. So politicians, it was 12, and for doctors, it was 57%. But that was a drop for doctors and nurses compared with previous surveys. But the medical profession is still pretty trusted. That may have been dented a bit by this inquiry. So I think another thing is a duty of candor, which doctors already have in terms of talking to patients about when things go wrong. But that should extend to hospital managers, which it didn't in my experience, and it should extend to politicians. I think at the end of the day, people will see this report as highlighting more of a political failure rather than a failure on behalf of those who work in the NHS, more of a political failure. I mean, clearly there were major errors in NHS and amongst NHS staff. But I think that the blame, will be more located with those politically in charge who clearly were in a position to make very important decisions and chose to make the wrong decisions or to ignore the evidence.